And so once I started learning about masking and realizing it was more like I realized, you mean not everyone's doing this? Like not everyone's rehearsing conversations for hours. Not everyone is like practicing facial expressions in the mirror. Not everyone is like has a script when they go into small talk. So that was the big aha moment, was when I learned about masking and realizing how much labor I was doing socializing that other people weren't doing.
If you've ever felt overwhelmed by the sensory world, struggled to find language for your internal experience, or wondered how trauma, autism, and ADHD can intersect, you're not alone. The path of living with neurodivergence in a neurotypical world can be layered, complex, and often misunderstood.
Today, we're exploring how complex trauma, autism, ADHD, and sensory processing challenges overlap, and why understanding these intersections is crucial for healing, for self-acceptance. You'll walk away with a deeper understanding of how trauma impacts neurodivergent nervous systems and what sensory integration really means, and practical insights for navigating both internal and external environments with more compassion, more clarity.
This conversation really opened up new ways for me to think about my own sensory system and how it shapes emotional regulation, relationships, and the way I move through the world.
Welcome to Trauma Rewired, the podcast that teaches you about your nervous system, how trauma lives in the body, and what you can do to heal. I'm your co-host, Elisabeth Christoph, founder of BrainBase.com, an online community where we use applied neurology, somatics, and emotional processing for regulation and resilience. And I'm also the founder of the Neurosomatic Intelligence Coaching Certification, an ICF-accredited course for therapists, coaches, and practitioners who want to bring the nervous system into all of the work that they do. If you haven't already, hit subscribe so you don't miss an episode. We bring you conversations that change how you see yourself and the world around you.
And I'm your co-host, Jennifer Wallace. I'm a neurosomatic psychedelic preparation and integration guide, and I bring your nervous system into your peak somatic experiences, maximizing what's potential in your healing and growth. And I'm also one of the educators at the Neurosomatic Intelligence Coaching Certification. And we really hope that you enjoy this exploration. Today, we're joined by Dr. Anna Neff, a clinical psychologist, researcher, writer, and the co-host of the Divergent Conversations podcast. They're also the author of Self-Care for Autistic People and Embodying Integration, and they've created a wealth of resources for folks navigating the world with neurodivergence. We're so excited to dive into this conversation. Dr. Neff, I am so excited to have you here and explore neurodivergence and the interweavings of complex trauma. And so I would love for you to just introduce yourself, if you would, to our audience and just share a little bit about yourself and how you got to being an expert in this field.
Okay. Well, first of all, thank you so much for having me. And now my brain is frantically trying to locate that question in space. Tell me about yourself. That's a hard question for an autistic person. So that's maybe part of telling you about myself, is letting you know my brain struggles with questions like that. I am a clinical psychologist. I discovered my autism and ADHD later in life after one of my children was identified, which that is becoming such a common story of parents who are learning this about themselves only after a child is identified. The research talks about the last generation of autistic and ADHD adults. So I'm very much in that camp. And then when I learned this about myself, it was a pretty powerful aha moment. So I really changed my professional trajectory quite a bit. And neurodivergence has become kind of my special interest. It's what I do professionally. And the thing I'm really passionate about is both educating the mental health world about non-stereotypical presentations, because our training is very far behind. And then also kind of the second prong of my, I guess, passion or mission is to provide wellness resources for the neurodivergent person in mind. So how did I do with that question?
You did great with that question. What was it like for you? I was listening to you talk about on another podcast, finding your way to your diagnosis through your children, like you talked about, and that is a pretty common experience for people. Would you elaborate a little bit on that and like what that was like for you, how that path unfolded? How did you see yourself in that diagnosis, and how did that change things for you?
Yeah, yeah, so and I think our story is a little bit different just because I am a psychologist, so, my child who was first identified had already been diagnosed with ADHD, and it's really interesting to look back when they were diagnosed with ADHD, like, I wasn't curious about it, and I don't know if it's because they were young and I was so tired but it was just like, "Okay, yeah, that explains things," but it didn't ignite, like, a special interest research rabbit trail. But there were just things that we kept seeing that were like, "This doesn't feel like ADHD fully captures this. Could this maybe be autism?" And then as soon as I would think that, I'd be confronted with the stereotypes of autism and be like, "No, there's no way." Um, but finally, after enough of these moments of like, it just feels like there's something more, I actually started the conversation with my child. I was like, "I I wonder if this is maybe more than ADHD. Maybe this is autism." And they were the one that was very like, "Well, that would if that is the case, that would simply explain like, it wouldn't change who I am, it would just explain some things." So together, we actually started kind of looking into, autism, specifically girls and autism, and actually within a night of starting that conversation, we were like, "Oh my goodness, all of a sudden your life makes sense. My experience of parenting you makes sense." Um, and they were the one that was very adamant, like, "I need to know yes or no, so can we pursue, like, an official medical diagnosis?" Um, that led me to a huge interest in understanding girls and autism because here I had just graduated with my doctorate, feeling so surprised by this information that I needed to know what was going on, and it was in the course of that I was like, "Oh my gosh, I'm autistic." And within a week of starting that research, I just knew I was autistic. And again, I also wanted and if because I have such a public presence, I wanted kind of a medical person to anoint me with, like, "Yes, you're autistic." So we both had self-identified before we went through the formal assessment process. So that's where it's a little bit different is I was drawing on a lot of the research. I had a lot of test data on myself to look at through the lens of a psychologist. Um, and so it was a less conventional route. Although I will say, I mean, there's a lot of people who first self-identify before they go on to get an official assessment.
I was gonna say too, and like sometimes something can kind of be floating around in the atmosphere, but it doesn't really come into your realm until it's really necessary. Because it was like for me, I'm trying to navigate this neurodivergent world and like, is it ADD, ADHD? I've always identified as a highly sensitive person, but also maybe it's definitely I really resonate with sensory deficit disorder or sensory processing disorder. And so I was reading a book, Divergent Mind, and it was all of a sudden like a light bulb went off. And I was like, wow, I started to cry. I was like, I'm really feeling myself in this book. Like all this has sort of been around, but I haven't been in the place maybe to recognize it or honor it or have the capacity to what would I do with it now with this information. And so it was really resonant to read that there were other people that it was like, other people have these sensitivities, not just to the world around them, but to the rooms that we're in with the devices and the electricity and all of those different experience things that I experienced. And it was it was really a beautiful time for me. So that was and I am in the process of self-diagnosing right now. And I'm thankful to NSI because I have ways that I can work with my sensory inputs so that I can um kind of lessen some of the outputs that come with being highly sensitive. And recently I retook the quiz just to kind of see where I was at. And I was really blown away by how much I'd been able to kind of pull it in, I guess, in a way, even though like I'm still very sensitive to people's emotions and the moods and the energies in the room. But like I really do understand how to look at that as a superpower now and as a guide to lead me in to help guide me through a world that is, somewhat overwhelming. Well,
Mhm.
quite overwhelming.
Um, great.
Yeah, I'd love to explore a little bit more about, this that place you were saying where we sometimes try to protect people from labels and diagnoses, or like, do everything we can before exploring this, but that it can actually be really powerful to be able to identify and find community and resources through that. And yeah, just I'd love to hear your experience a little bit more on that, about the ways that it was empowering or helpful, or why you think it's important for people to be able to have these identities.
Yeah, I mean, I think it names an experience. I think especially with autism. I think with some other labels too, but I notice this most pronouncedly with autism. Um, so I think in images, and it feels like when I was given the label autism, it felt like all of the other things I had going on all of a sudden made sense. Like autism was like the sun, and all of the other things were kind of orbiting around it, and autism was the thing that explained all of the things. Um, and that was so helpful because before it was just these fragmented, like, why do I feel like I can't be present in my life? Why do I struggle like with relationships? Why do I struggle with contentment? Why do I struggle with XYZ? And there were just so many mysteries that were fragmented and disconnected and didn't have a narrative to hold them together. And once I had autism, it created a narrative where my life and my body and my experience of my body made sense for the first time. Um, I have a really distinct memory, and again, this was just a week after I'd opened the door of maybe autism. I was, sitting across the room from my spouse, and I said to him, "I feel at peace in my body for the very first time." Not that that means my body's an easy place to occupy, it's not, but it made sense to me, and just the fact that it made sense was so, regulating because I understood it. I understood my experience. And so that's some of the power of having a lens is we can now name a thing. I mean, you both work in trauma, you know this, like, when we name a thing, like, our system can calm down. It's like, "Okay, I understand what's happening." I don't have to keep that hypervigilance to be like, "Well, what is this? What is this? Is this scary?" Um, so the power to name a thing, I think, is a huge part of it.
I think so too, because your body really knows when something is truth. And if you can understand to listen to the way that your body speaks to you, and the sensations, like you said, your body speaks to you in images, like there are so many ways our body communicates to us. And to have a relationship with our body means that we can understand those sensations and interpret them accurately and be able to be in a deeper place of communication, which can lead to, from a foundational place, lead into an actionary place that feels more grounded, whether we're looking for like more resources or community. And, I really, one of the things I've been thinking about this too in this conversation is the idea of a neurotypical world. And like, D eh what is that? Like, what does that mean, really? Like, what is that? Because, like, we live in all these constructs and boxes, and we've got complex trauma, and we've got brains that are all different from each other. No one brain is alike, and then we have the widespread complex trauma wrapped up in our institutions, in structural forces, and systemic trauma, and it's like what it all leads to is this non-expression of the human at the light form, at the like there's a very big limitations in self-expression, and how much we're harming our society in growth because we don't honor people's self-expressions. And I wonder, like, what's the neurotypical world, this structural trauma box that we all live in? Like, what does that mean? Can
The
you help me with that?
Yeah.
If you're a practitioner, coach, or therapist who's noticed that cognitive strategies only get your clients so far, you're right. Change doesn't start in the mind, it starts in the nervous system. That's why practitioners from therapy rooms to Fortune 500 coaching programs are using neurosomatic intelligence tools to shift beliefs and identity at the root. Leaders in the world of coaching, like Kate Northrup and hundreds of practitioners around the world, have integrated these methods to accelerate breakthroughs for their clients and for themselves. Join me and Matt Bush for a free live workshop packed with actionable strategies you can start using right away. The Neurosomatics of Leadership and Belief Change on July 9th. You'll learn why your clients' nervous systems, not their thoughts, drive their behaviors and how to work with that for faster, deeper transformation. Register now at neurosomatic.com/leadership. That's neurosomatic.com/leadership. I can't wait to see you there.
Yeah. My, like, sociology hat is coming back on. I studied sociology in undergrad, and I think I'd wanna nuance it of the white neurotypical world. Like, I don't know about y'all if you've ever lived, overseas, but I've spent a few times in immersive cultures, like, Malawi and Ghana, most specifically, and especially Malawi. I spent 6 months there in undergrad, and I had such a profound experience of and I was terrified to come back to the States because I was just like, "I feel like I'm learning what it is to be human here." And I feel like that's not something I've had access to in my white culture. And, so that's where the sociology comes in. I'm also thinking about modernity, I'm thinking about the Industrial Revolution, I'm thinking about, like, really the last 500-ish years of our history where we've done something really weird to our humanity. I think that sometimes gets missed, but this idea that when you woodwork a chair, you are expressing your human nature in that creation, in that labor. So as soon as we put a price tag on that labor, like, $8 an hour, and we divide it from the expression of our humanness, we're doing something quite detrimental to our human nature and how we express it. Um, we've just done a lot to divorce ourselves from our human nature, and I think especially in kind of white neurotypical culture, you can see that, and then once you get out of that, I think for a lot of us, maybe have a similar experience of like, "Oh, this is what it is to be human. This is what it is to have a body and have connection and to, um, be grounded in earthiness." But yeah, I'm as someone who does have children, like, I'm very concerned about what we've done to our experience of humanity just as a society, specifically, again, white, industrial, modern, capitalistic society.
I gotta let that one sit for a second. That's a really, it's really profound to think about how much we have divorced ourselves from our humanity and the way that that impacts us, brain function, nervous system, health wise. Like it's a lot to take in. And on this podcast, we're always exploring primarily complex trauma and its impact on the nervous system. And this season, particularly, we've been exploring more diagnoses and neurodivergence. And it's really, I'm really in a place of trying to understand the overlaps because there seem to be so many, right? When even if we just look at, if we define trauma as this overwhelm of the nervous system beyond the capacity to cope, and we are maybe even just born with a natural neurodiversity that makes our sensory processing such that it is constantly being overwhelmed by the world that we live in, or maybe it's because of the society that we live in now and the constant stimulus, that just moving through the world is kind of traumatic in that nervous system. And so how do we I don't know how to start parceling apart complex trauma and
Hmm.
neurodivergence, and are they can you separate them, or are they just two things that are constantly intermingling?
Mhm. This feels like so here's the image in my head is like, I don't know if either of you are knitters, but like yarn, and it's like when there's knots in it, and it's like we could start this conversation so many different places and like pull at the thread. At the most basic level, so CPTSD, complex trauma, or PTSD, they are forms of neurodivergence. If we take kind of that definition of neurodivergence as someone whose brain processes information differently than neuronormative culture, then these are forms of neurodivergence. If we're talking more specifically about like autism and complex trauma, then those often do co-occur, not always. Or ADHD and complex trauma, again, often co-occur, but not always. There's reasons why autistic and ADHD people are more vulnerable to complex trauma and developing PTSD after a stressful encounter. And for exactly what you mentioned, like just moving through the world, things that like we want, I'm sure you all have thoughts on like big T, small t trauma. Like that's not a, there's limits in that helpfulness. But things like if we're looking at PTSD, things that we would say this is criteria A. So when you're diagnosing PTSD, there's criteria A, which is the presence of a traumatic incident, and there's kind of a list of things that fall under that. Some research that came out in 2020 was suggesting that even when autistic people don't meet criteria A, they will sometimes still develop PTSD. So one of the things we're seeing is we're not capturing well what's traumatic for a sensitive system, which is I think what you were getting at there of sensory trauma, social trauma. Like these things are also, especially when done over a lifetime, are also traumatizing for the system. But we don't have like diagnostically, we don't have great language for that yet.
Megan Ann, when you said complex trauma is a neurodivergence, that just like hit me. Like totally. It made me kind of well up even a little bit because I do think about the way that my brain developed under the chronic stress that I experienced as up until my 40s, probably up until 40, 35 or really like 37 really, because that's when I got diagnosed. So we'll just say my stress level up to 37 was like really big. And we do know that complex trauma impacts brain development and sensory reactivity, and that, complex trauma patterns the nervous system to have a higher sensitivity and to sensory stimulus in the world. And it shapes how our brains interpret information and integrate that sensory information, and that it's so malleable and adapting to the relations and connections. And so it's just so interesting to think about how these patterns all persist into adulthood and shape the way that we respond in social situations, now to physical stimuli as adults. And then we've got all these potential diagnosis and identities out there now that the world is really like opening up for us, I feel like, in this realm. And yeah.
Can I ask you something?
Sure.
I'm curious if it is interesting because complex trauma, CPTSD, like it's very much a diagnosis, and I don't really hear. I mean, I see a lot of community forming around this diagnosis, but I don't see it as like the shift to identity in the same way as I see happening in the neurodivergent world. So I'm curious for you holding like CPTSD as in like I am someone who's experienced this, or I don't know if you would use like I am versus I am neurodivergent. Like, do those feel different in how you hold them? Like, would it feel different to be like I am neurodivergent versus does that question make sense?
I think it does. The idea of being neurodivergent has just kind of come into my realm in the past 6 months. And so I've been holding so much space for the complex trauma, understanding ACE scores. I'm a breast cancer survivor, like looking at the way that my life has been, the inflammatory responses have been impacted by, right, the stress. And so neurodivergence has really just, neurodivergence has just come into my realm, but the idea that my brain has shaped through these experiences in various ways, and understanding like I've known for a while that I have a low executive functioning, and that I work to lighten up my prefrontal cortex. Like I have to do intentional exercises every day so that I'm like activating that higher order systems of thinking. So I've been doing this stuff along the way, but the label of neurodivergence, that's very new for me. So I'm trying to not have them in different spaces, but I'm trying to integrate them together but you just opened my world up. Like now I feel like that marries them. That makes sense for me. I don't have to think about, oh, I have complex trauma and I'm neurodivergent. Like complex trauma is a neurodivergence. The end. I'm feel fuller with that.
Yeah.
Yeah. I think like when I first started learning about complex PTSD, a lot of my life made sense to me, a lot of my behavior, my addiction, my past, my history, um, my autoimmune. But now as I've been exploring neurodivergence more, and I was someone, I was diagnosed with dyslexia and ADHD as a kid, and but never really identified too much with that. And now as I'm coming back and revisiting that as an adult, I do feel a little bit different about my relationship with both. Like I have this relationship with my CPTS where I understand that I will sometimes have reactions or emotional flashbacks. And there's a different level of self-compassion for myself with this diagnosis and understanding how my nervous system was shaped. But now as I'm exploring neurodivergence, it's more like I'm seeing patterns in my partnership or like in the expectations that the world and my partner and other people maybe have of me, that I'm like, now I'm a little bit more like, no, I don't need to fit into this because
Mhm.
I have other ways of being. My brain maybe just works a little bit differently. And that's not something I even really want to try to change. It's something that I'm just like, maybe this is just
Mhm.
who I am. And I'm getting more comfortable with navigating through the world differently, if that makes sense.
It makes so much sense, and I'm fascinated by the 'cause this whole neurodivergence conversation sits at the intersection of, like, diagnosis and identity, um, so I'm really fascinated by this conversation, and I like, 'cause I do the same thing where for me, with my anxiety or my OCD or my depression, it's helpful for me to do some of that externalizing of like, "Oh, that's my depression talking right now," or, "That's my OCD acting up," to, like, distance from it, and I could imagine the same thing with CPTSD of like, "Oh, that was a trigger on my system right now." Whereas with neurodivergence, like, as an identity, it's something I'm able to take pride in. It's something I'm able to connect with my culture through it. Like even in this conversation, right? Like a few years ago, I wouldn't have started that our talk with like I struggle with that question, but even being able to be comfortable enough with like, here's a communication difference I have that comes from embracing a neurodivergent identity. And it is interesting, just the nuance of how we hold and experience these diagnoses, these identities, and how we can find empowerment um, through the identity of neurodivergent.
There is something interesting here happening in the conversation around the idea of like being able to identify with a neurodivergence, or this is the way that I'm built, I'm shaped, this is the way I'm wired, and expressing what our needs are is very empowering. But there's something around complex trauma that has a more of a limitation around it. Is that what how we're kind of like shaping this a little bit? Like, or that complex trauma is more about there's two energetic shifts here between what we were just like what y'all were just
Yeah,
saying.
I like that language of energetic shift because I don't know if I have words for it fully. And it is interesting. Like I've heard a critique of, especially in the States, this movement to over-identify with medical diagnoses, and um, I do think it's possible to end up having, like, a fixed mindset. Like, if I was like, "Oh, that's my OCD, and there's nothing I can do about it," I don't think that's gonna be helpful for me, versus kind of a more growth-oriented mindset of the being able to identify um, this is an unhelpful thing that is part of me, I'm not judging myself for, but it's here, it's kinda hijacking me in this moment. Okay, I'm gonna name you, I'm gonna see you, I'm gonna, like, acknowledge you, and then I'm gonna move on. That does feel energetically different than, like, I'm neurodivergent, this is how my brain works, this is how I communicate, this is how I do relationships. Um, yeah.
Yeah, I do feel that too. Like it's kind of what you were saying, Jen, of like the the CPTS is a part of who I am now, and there are some assets that come from the way that my nervous system is reactive, and then there's some things like a big emotional flashback or where I feel like that is a trauma pattern that has shifted my filters, the reactions inside of my body, an inflammatory response that I don't necessarily want, that I'm not necessarily like, oh, I'm gonna just embrace this as part of my experience. I do want to work with it. I want to have compassion for it, but that there is sometimes limitations that comes from the trauma, and I do want to work with my system to repattern and to make navigating through that easier, versus maybe some of the just inherent differences in my brain that I'm more inclined to want to embrace and set boundaries around and create a world that is more that fits with that better,
Do you think
maybe.
this idea or desire to be identifying as something, or like having an identity to something, over diagnosing, self-diagnosing self, um, do you think it has something to do with the DSM not recognizing I know some of the neurodivergences are now starting to come into more visibility, but not the complex trauma. And so there seems to be an underground movement of somatic therapy, somatic healing, nervous system work, and that like we are part of a really big movement because there's not a recognition somewhere else. And so maybe there's this desire there for the identity, and that's coming our from
I
community.
Yeah, I hadn't made that connection before. I think it's absolutely possible. First of all, like, oh my goodness, I don't know why the DSM has not adopted. I mean, I do know why, but like, or I've read why, but like, yes, I think that is a very that's short-sighted that they have not yet adapted it, and I hope they will in their next edition. Um, and yeah, that is really interesting, like, because it's unrecognized officially, that there's been this kind of grassroots movement around somatic. I also think I think that in the last, especially like 20, 30 years, we're seeing more conscious awareness of a critique of that industrial modern kind of white neurotypical culture we were talking about a moment ago. And more and more people are longing to reconnect with their humanity, with their bodies, with their nervous system. So I think somatic practice is also a way of people are saying, like, this is not enough. This is not how we want to live. And then, especially if someone has been alienated from their body through trauma or through innate wiring, there's even more of that drive to find community and practices that are supporting that work.
I want to, for listeners, to allow them to see some of the stuff that connected the dots for you guys, because you were both talking about things that you read that started to turn on these light bulbs for you of like, oh, I am autistic, or I have ADHD. What were some of those things that came up for you that you saw in yourself that helped you start opening that door?
Oh, that's a great. Let's see. I have to go back in history a little bit. It's easier to say the reasons I thought I couldn't be autistic. I thought I couldn't be autistic because of that myth out there that autistic people aren't empathetic. I have hyper empathy. I feel people's emotional tone very sensitively. So once some of the I read enough to learn some of those myths were debunked, that was really helpful. I think for me, the thing I resonated with the most was the special interest. I That's my highest autistic trait. I'm very monotropic in my brain, and will get a special interest, and that becomes my filter for the world for, like, often for years. Um, so that I definitely resonated with. The sensory sensitivities, it's interesting. I had grown very, dissociated from my body because of my sensory experiences, but at the same time, I could point to, like, well, I can't be around someone in striped shirts, or I can't go to the grocery store through the laundry. Like, I knew there were things I just didn't like doing, but I hadn't connected the dots that would be related to sensory. Um, I think other just once I started learning about masking too, so autistic masking, this is more common in women and girls, but anyone can mask. It's also very common among BIPOC and genderqueer folks, but also cis het men can mask. Um, and so once I started learning about masking and realizing it was more like I realized, you mean not everyone's doing this? Like, not everyone's rehearsing conversations for hours. Not everyone is like practicing facial expressions in the mirror. Not everyone is like, has a script when they go into small talk. Um, so that was the big aha moment, was when I learned about masking and realizing how much labor I was doing socializing that other people weren't doing.
That is so relatable. And that like high criticism or like high fear of like criticism and being judged and thinking like I have to do something so many times to try and get it right. And yet I can never like quote get it right. And like some of the it was really relatable. Like some of the funny sensitivities, like sensory stuff would be like I cannot put my hands in dishwater. There's like and I really do create a very nice atmosphere for myself because I am very visually stimulated and I feel very calm by colors and different patterns and smells. And then like for me, some of the organization and disorganization, that is very relatable for me. Like I can just put my hands right into one of my places, one of my cabinets or cupboards or bags of whatever it is, and like I know exactly kind of where something is, and the like inability to sort of organize or get like not I don't know how you would call it, but like missing dates, missing times, getting confused on calendar, always late. Like I cannot get it is so hard for me sometimes to just get myself out the door, and I get really highly stimulated by sounds. Really by the auditory stimulus can really be very provoking in my body, and yeah, logistical challenges, and then that coming with like never feeling good enough. Never feeling like yeah, never not feeling good enough, not feeling capable.
Yeah, yeah, incompetent. That's a, like, intrusive word that comes in and it still does, but I'm work with it differently, but, like, that was a constant, like, "You're incompetent, you're incompetent, you're incompetent." Like, that was a constant
Mhm.
kind of meta story I was telling myself. I relate to
And
that.
then like
Yeah.
that inner critic of complex trauma comes in, right? This is where some of the overlaps come through, right? Because then it's like
Mhm.
now you have this very punishing, bullying voice in your mind that's like, you suck. You can't do anything.
Yeah. Yeah. Yeah.
Yeah. One of the things you said too also really kind of lit up some dots for me when you were talking about having been pretty dissociated and then also realizing that that might be because of the heightened sensitivity to sensory. I think I have also been very I move into dissociation very, very fast. It's a well-worn path, well-worn protective mechanism of my nervous system. And I've for so long thought I'm just someone that needs a lot of sensory stimulus to get a response from my nervous system because I do a lot of sensory training and I'm like, I got to stack it on. I need lots of stimulus for my nervous system to have any kind of response. And I'm really starting to think now that that may be true now, but that that comes from the sensitivity that was there before, and that that dissociation has been patterned on top of that sensitivity. So now I'm not very sensitive to a lot of stimulus, but actually I am.
Mhm.
It's just the dissociation that's been layered on top of that.
Wow.
I I love that insight. I appreciate yeah, I mean, my system's very similar to you in that way of, I respond to sensory overwhelm by shutting down. Once I learned about, like, dorsal state, it was so helpful, and once I realized so this was actually I have kind of a flip narrative to both of you in the sense that, so I'm so thankful for what the mental health has world has done around trauma and ACEs. Um, and there's been kind of a cognitive bias that is formed. Like if we see certain traits, it's like, oh, it's trauma. So I was actually in the process before I discovered my autism. I was in depth therapy, and I was like, is there repressed trauma here? Because I'm dissociated a lot of the time. I'm not in my experience. My life didn't make sense, and the only narrative I had access to was trauma. So, I was gently exploring if that was a possibility. And then when I discovered autism, all of those things made sense through this new lens. Um, and the biggest one being dissociation, because when I'm sensory overloaded, I don't have a meltdown, I shut down. and I feel like I'm in a dream. And I would tell my mom that since I was a young girl, like every time I go to the grocery store, I'd be like, I feel like I'm in a dream. And that just became kind of something I would say throughout my life. And I didn't know what was happening. I would just be like, oh, the dream is here. Like I'm back in the dream. But what I was explaining was dissociation, which absolutely can be a response to the sensory world being too much.
Wow, you guys. I'm the meltdown type. Huge emotional. Yeah, I just, even now, if I just get overwhelmed, I'll just start to cry. I just start to cry. But I was really on a swinging pendulum, but this is really fascinating to hear you guys talk about this, your experience with dissociation and sensory overwhelm in this way.
Well, and it's interesting too because I had huge meltdowns as a kid, huge tantrums, and then at some point it like switched, a switch flipped, and I now like it's been a very long process for me to come back to be able to experience any emotion or to express any emotion and to stay present in my body. But there were huge meltdowns and big emotional expression. And then at some point, I guess that was not adaptive and not safe and was causing too much stress either to my system or to my caregivers. And so I think I learned over time that deep repression. And now it's a really different experience of, yeah, I'm definitely more of a dissociator.
That's not an uncommon pattern. I see that. And so masking is associated with a more kind of hypoarousal stress response. Because that's part of masking is masking that overwhelm. And so I hear that a lot. I see that a lot where it's at some point it flips and kind of how the body responds to stress. Can I ask, do you have alexithymia, or is that a concept you all have covered on your podcast?
We haven't covered it. I think I do. I think I do.
Mhm. I
I
do
have
too.
a
Yeah.
very difficult time feeling emotions in my body, understanding what they are, being able to express them. Like when I first started somatic therapy, because I knew I needed to, I knew cognitively I have all these ACE scores, there's stuff going on. And then someone would ask me like a very simple question of how does it feel in your body? Where do you feel that? And it was like, I was gone
Yep.
for days, and
It
couldn't come
yeah.
back from that
Did it
state.
feel intrusive when they'd ask you that?
Oh, yeah,
Yeah.
panic,
Yeah.
panic,
Totally.
and
Yep.
then I wanted to get out of there. I probably
Yep.
never went back to the
Yep.
therapist, and if I did express emotion, the shame I felt afterwards, and then sometimes my body would react really violently. I'd
Mhm.
finally get to a place where I could express anger or vocalize or shake, and I would get a rash all over my body, my joints would swell up, and my body was very resistant.
If you've been listening to Trauma Rewired, you already know our nervous systems predict safety long before our minds can catch up. And belief systems, they're not just cognitive, they're embodied. That's why Elizabeth Kristoff and Matt Bush are hosting a free live workshop on July 9th called The Neurosomatics of Leadership and Belief Change. This is for coaches, therapists, and practitioners who want to move beyond cognitive models and work at the root level where change actually happens, the nervous system. You'll get the latest science on how predictive coding shapes your clients' beliefs, how to retrain those patterns safely, and learn how to integrate NSI into your work for better outcomes. Join us live July 9th. Save your spot at neurosomatic.com/leadership. That's neurosomatic.com/leadership. We would love to see you there and deepen this work together.
My body was very resistant.
So that's interesting. I don't know if you know this, but alexithymia is correlated with chronic pain and a lot of chronic health things. And the idea being kind of like if we can't express the emotion, then our body has to like kind of ramp it up, the communication. But it's a personality trait and it's difficulty identifying and labeling and expressing emotions. About 10% of the population has it, although within the neurodivergent population, it's much higher. So about like 50% of autistic people have alexithymia. There's innate alexithymia, or there's thought to be innate alexithymia, which is like so like for me, I'm pretty sure it's connected to my brain wiring. And then there's secondary alexithymia. So like in the aftermath of trauma, a lot of people will develop it. And again, it's a protective mechanism, right? Like if I'm having overwhelming emotions, I'm just going to shut them off. Um, so so it's not something that's diagnosed. It's considered a personality trait, but it occurs with depression and trauma at high rates, and then it's just more prevalent in ADHD and autistic populations in general. Oh, it's also connected to interoception, which is the sensory system around picking. So when a person has differences in interoceptive awareness, the ability to identify like thirst, hunger, emotions, then it makes sense that they'd also have alexithymia because that's internal signals.
Yeah, it's so
Wow.
interesting because it's so funny how the work always brings us, like, it comes from our own stuff, because so much of my work has been dedicated to emotional expression, learning how to process emotions in the body, interoceptive training, passive tools for interoceptive stimulus, wearing an ab belt or doing gentle sensory stimulus for the non-myelinated fibers, or working with my vagus nerve, or just all these kinds of ways to heal my interoceptive deficits. And it is it is probably from my own journey.
Wow.
Yeah. Yeah. It is interesting how much of what we're gravitating toward professionally is also it's part of our own healing.
Yeah.
Always on the path.
Mhm.
Always on the path. Could we talk a little bit too about you were mentioning with your daughter looking at some of the research and the information about like women and being diagnosed with autism, and some of the differences there. I feel like women are often underdiagnosed, or there's not as much research. There's different hormonal components there. And I'd love to just speak to all of that a little bit because I'm so interested in it.
Yeah, absolutely. I mean, and again, part of it goes back to the myths and just the bias, the gender bias in research. So a lot of early research was on white cis het boys. And so that then we created, research scales and we created like based on that experience. And so that really solidified like this is what autism looks like. A really interesting study came out, I think in 2022 that used a statistical analysis that can't fully wrap my mind around, but it was looking at the true prevalence of autism in females. And so there's often it's often quoted like there's 4 autistic boys to every 1 autistic girl or 3 to 1. And what they were finding is that the true ratio is actually 3 to 4, meaning 3 autistic boys to 4 autistic females, meaning there's more autistic females than males. Also, this is a great place to say a lot of autistic people don't fall into the gender binary, myself included. So females, males, but then also knowing that a lot of folks will identify either as trans or genderqueer. Basically, we just haven't known kind of what autism like how it presents in girls, and there's been this bias. So historically, a girl would have to have more autistic traits to get the diagnosis. So part of that is kind of bias of providers. But then also we do now know that girls are much more likely to mask their autism or camouflage their autism, and that's where they are the way I describe it, it's like they're using their prefrontal cortex to move through social space. So they're analyzing and they're studying. They become little social scientists of like, okay, who's cool? What are they saying? What's the language they're doing? And then they can blend in a bit more easily. And so that's one of the reasons that they also go unidentified. The group that goes most unidentified are autistic females without a co-occurring intellectual disability. And again, these are the ones that are gonna be masking quite a bit. So and that used to be diagnosed as Asperger's. That's not a diagnosis that's used anymore. Um, so, like, when they looked at the statistics back when Asperger's was used, I think it was 9 autistic or Asperger boys to 1 girl. And again, that's not because that's the prevalence rates, that's because that's the identifying rates, meaning what that suggests is we were really, really bad at identifying the smart autistic girls.
Yeah. That makes sense when you think of masking. I mean,
Yeah, yeah.
isn't that how we all got here?
Yeah. And then some of the
Really?
cultural conditioning, right? Like sensory sensitivities. That's
Sure.
often a more prevalent rate among autistic females. And it's often interpreted as like, oh, she's sensitive or she's oversensitive or she's dramatic. She wants attention. So there's also the cultural conditioning. Um, or even the measurements. Like they ask about lining up trains. They don't ask about lining up dolls. They don't ask about like the play, even though it can have that same like I'm collecting things or I'm lining things up. It's not necessarily as noticeable if it's something that culturally blends in. And our special interests are often ones that also blend in more. So it might be social justice, it might be psychology, it might be animals, but they're things that are often, it could be books, they're things that are often praised by society. So even though they're intense, they're less likely to kind of raise thought that this might be autism.
Do you think that with this, the higher presentation in women, do you think that gives rise from the hormonal place of our body and all the different ways that we are kind of shaped biologically? With the
Um,
the chemical places and
yeah. I don't know, there's different theories around that. I don't think I know it well enough. The one thing I do know about ADHD is that ADHD often becomes more pronounced after puberty, and so and some of the diagnostic criteria is, it's now 12, but a lot of it really emphasizes early childhood, and so that disadvantages females who might have more obvious ADHD traits after puberty. Um, but yeah, I'm less aware of kind of autism and how that influences. I mean, we're all both autistic and ADHD females are more prone to like PMDD and all kinds of hormonal sensitivities, which
Mhm,
again, I
mhm.
think does make us more likely to it get interpreted as a mood disorder versus a neurology.
I've one of our big topics this season that we're exploring here on the podcast and that we're exploring personally is rest. And so I was listening to Divergent Minds one day on a walk, and it was an episode on rest. And I did pick up a new tool from you where you say a word, and then, like, the word that you gave was ocean, and then you name as many things as you can with O, with C, with E, and it works. I just wanted you to know, and I just wanted to say thank you. That's been a tool that I use probably most nights.
Oh my goodness, that makes me so happy. Yeah, I when I learned about cognitive shuffling, I've always had insomnia. I was like, and it's kind of it feels a little bit magical how it like I mean, maybe people don't tell me when it doesn't work, but everyone who I've introduced it to is like, "Oh my goodness, it actually works." I'm
Yeah, I
so
was
glad that
laying
yeah.
in bed with my Z vibe in my mouth, vibrating my jaw, trying to drop into parasympathetic state and like do my what did you call it?
Cognitive shuffling, so you're basically
Cognitive
shuffling
shuffling.
your thoughts through that through a structured way, because that mimics that first stage cycle of sleep, and we can't ruminate and get in our anxious mind when we're shuffling our thoughts. Yeah, I hadn't thought of it till you were talking about it, but it could also be a really powerful grounding technique during, like, in moments where we need to ground.
The Divergent Conversations podcast has some I was listening to a bunch of episodes before we recorded this, and you guys have such great practical little tips, just little ways for people to ground when you were talking about, like, just holding a smoothie and feeling the cold and letting that be a way to start very gently training your interoception and the cognitive shuffling, and it's a really good resource, so I hope people will check it out because there were some great conversations on there.
Oh, thank you.
Thank
Thank you.
thank you so much for all of this conversation today. It's been expansive.
I do have a thought. It's circling back to the conversation about kind of the overlap of complex trauma and autism or ADHD. I think there's a lot of reasons I think these overlap at high rates, partly because of more sensitive systems. But I also think, neurodivergence is very genetic, and a lot of our parents would have been unidentified, unsupported neurodivergent people. And so I think that is another reason that these walk together so often is because of the generations that didn't get identified, that didn't get supported, that didn't have tools to support themselves when they're having a sensory meltdown, when they were having an emotional um, meltdown, when they were underemployed and having the stress of that. And so I think that is part of the picture, is this kind of multi-generational process. And I think that part often doesn't get highlighted in the conversation. So that was a thread that I had in my head, but that doesn't feel like a sign-off piece of information.
I'm really glad you brought it up, because there are so many ways that these things continue to be passed down and compounded through the generations because of the lack of resources and information and tools and acceptance that people have it in different generations. And so I think absolutely that has to be something that's considered when we think about trauma being passed down generationally. Also, the different divergences in our brains and our sensory processing, and how, yeah, I mean, our parents did not have the tools to navigate that. And so we're being shaped by a nervous system that is under that constant dysregulation as well. Thank you so much for all of this. I feel like it was just a really, really powerful conversation. You have so much knowledge, and it's really an honor to have you on the show.
Thank you for having me. I've really I've felt alive and engaged during this conversation, and I've really appreciated it.
Thank you so much. It's been really enjoyable.